Welcome to Lesson 1 on the importance of patient communication in adverse drug reaction reporting. Today, we'll discuss patients' crucial role in reporting ADR and how effective communication can empower them to participate actively in their healthcare journey. So, let's get started. First, we need to understand the role of patients in ADR reporting. Patients are at the forefront of experiencing the effects of medications. Their insights are invaluable in identifying and reporting any adverse reactions they may encounter. Imagine this: patients are often the first to notice unusual symptoms or side effects when taking medications. These observations are like early warning signals in the healthcare world. Let's explore the significance of patients in ADR reporting. Early detection. Patients notice changes in their health that healthcare providers may not be aware of yet. They're like the canaries in the coal mine, sounding the alarm when something doesn't seem right. Timely reporting. Patient reports can lead to early identification and intervention in the case of ADR, preventing further harm and ensuring patient safety. Data contribution. Beyond that, patient-reported ADR are a crucial source of information for regulatory agencies and healthcare providers to monitor the safety of drugs. Your reports matter. Now let's talk about empowering patients to recognize and report ADR. Patient education is key here. By educating them about common ADR symptoms and the importance of reporting any unusual changes during drug therapy, we enable them to be proactive in ADR identification. Recognizing ADR. Once awareness is in place, we move on to helping patients recognize ADR. Patient education. Educating patients on how to identify potential ADR symptoms is crucial. Common signs, and of course, discussing red flags and warning signs for various ADR based on the medications they are taking. Encouraging reporting. Encouraging patients to report ADR is key to medication safety. Open communication. It is essential to create an environment where patients feel comfortable discussing their concerns and experiences. Now, let's talk about why reporting ADR matters not only for patients, but also for the broader healthcare system. Patient well-being. First and foremost, reporting ADR is about ensuring the well-being of patients. When you report an ADR promptly, it allows healthcare providers to take action, potentially preventing further harm. Medication safety, but it goes beyond that. Reporting ADR contributes significantly to overall medication safety. When regulatory agencies receive ADR reports, they can identify potential safety issues with medications. Regulatory action. This can lead to regulatory actions such as the review or withdrawal of a medication from the market, ensuring that it doesn't harm others. Continuous improvement. Each reported ADR contributes to a broader database of medication safety information. This data is used to improve drug labeling, guidelines, and prescribing practices, ultimately making healthcare safer for everyone. So when you report an ADR, you're not just helping yourself, you're actively participating in a system that ensures the safety and well-being of patients across the country. Your encouragement matters. So, as we empower patients to recognize and report ADR, we must also focus on building trust and open communication. Building trust and open communication with patients is essential. Patients who feel comfortable sharing their experiences and concerns are more likely to report ADR. Active listening, empathy, and validation of patient experiences foster a trusting and open relationship. In this section, we'll explore the essential elements of building trust and effective communication in the context of adverse drug reaction ADR reporting. Trust as the foundation. Trust is the bedrock of any patient-provider relationship. Without it, effective communication and ADR reporting can become challenging. Trust building. How do we establish trust? It begins with empathetic communication and consistent care. Patient confidence. Patients who trust their healthcare providers are more likely to report ADR. They know you'll take their concerns seriously. Effective communication strategies. Effective communication goes hand in hand with trust. Let's explore some strategies. Active listening. Another crucial aspect is active listening. It involves not just hearing what patients say, but truly understanding their concerns and questions. It's about giving your full attention to your patients and encouraging them to share their experiences. Empathy. Empathy means understanding and sharing the feelings of your patients. Patients who know you genuinely care about their well-being are more likely to trust you. Empathy can't be overstated. Showing that you understand and care about your patients fosters a sense of safety in reporting ADR. Informed consent is essential in ADR reporting. Let's dive into it. Informing patients. Patients need to be informed about the potential risks and benefits of their medications. Transparent communication is key here. Transparent communication. Be honest about the importance of reporting any unusual symptoms or side effects. Patients should know that their input is invaluable. Respecting privacy and confidentiality is crucial in healthcare. Let's explore how it applies to ADR reporting. Data protection. Ensure that patient information is handled confidentially and securely. It should never be accessed or shared without authorization. Patient anonymity. Patients should feel secure when reporting ADR. They should know that their information will be kept anonymous and their privacy will be protected. In conclusion, building trust, effective communication, informed consent, and privacy and confidentiality are the pillars of successful ADR reporting. By fostering trust and open communication, we empower patients to report ADR without hesitation, ultimately making healthcare safer for everyone. Remember, effective communication with patients is a two-way street. By listening to their experiences, we can identify potential ADR early on and take appropriate actions to ensure patient safety. Lastly, we'll address the barriers to effective patient communication in ADR reporting. Time constraints, language barriers, and fear of judgment can hinder open communication. However, we can overcome these challenges by allocating sufficient time, using interpretation services when needed, and creating a supportive atmosphere. We'll delve deeper into each point and explore best practices for patient communication in ADR reporting. 1. Lack of awareness about ADR. Raising awareness about ADR is the first step in empowering patients. Educational initiatives. Initiate educational programs and materials in healthcare facilities to inform patients about ADR. But we understand that learning is most effective when it's relatable. That's why when educating patients in Kenya, we should provide real-life examples of common ADR that are relevant to their experiences. Let's take a look at a few examples. Skin rashes. Skin rashes are a common ADR. Patients might notice unusual redness, itching, or blistering on their skin. If they are taking medications and experience such symptoms, it's essential to report them. Gastrointestinal discomfort. Many patients might experience gastrointestinal discomfort when taking certain medications. This can include symptoms like stomach pain, nausea, or diarrhea. It's crucial for patients to recognize these signs. Allergic reactions. Allergic reactions are another example. Patients may experience itching, swelling, or difficulty breathing. This is a serious ADR that requires immediate attention. Local medications. Additionally, we must consider ADR related to medications commonly used in Kenya. For instance, patients taking antimalarial drugs should be aware of potential side effects like dizziness or headaches. 2. Lack of awareness of reporting channels. Sometimes, patients may not even know where or how to report ADR. Local reporting channels. Inform healthcare providers about local reporting channels here in Kenya. They play a critical role in guiding patients. Patient awareness. Encourage healthcare providers to actively share these reporting channels with patients. Let them know how and where to report ADR. 3. Patient education challenges. Patient education is essential but can face challenges. Limited health literacy can be a barrier. Some patients may struggle to understand complex medical information. Addressing limited health literacy. To overcome this challenge, we should use plain language and visual aids. Make information as accessible as possible. Lack of awareness of ADR. Another issue is that patients may not even be aware of adverse drug reactions or what they entail. Bridging the gap. We can bridge this gap through education. Raise awareness about ADR and why reporting them is crucial. 4. Language and cultural considerations. In Kenya, we're a culturally diverse nation, and language plays a vital role in effective communication. Diverse populations. Patients come from various cultural backgrounds. Ensure that patient education materials and communication are culturally sensitive and accessible. Language barriers. Language can be a barrier. Address this by providing information in multiple languages commonly spoken by patients. Translation. To overcome language barriers, provide translated materials for patients. Ensure that they can access information in their preferred language. Simplified information. Simplify complex information. Use plain language and visual aids to convey important details about ADR and reporting. 5. Stigma and fear. Stigma and fear surrounding ADR reporting are real concerns. Non-judgmental environment. Create a safe, non-judgmental space for patients to report ADR. They should feel comfortable sharing their experiences. Reducing stigma. Educate patients on the importance of ADR reporting. Explain that it's a positive step toward better healthcare for all. Overcoming these barriers is crucial for effective patient communication and ADR reporting. We're working together to make healthcare safer,